Hello, welcome everybody. I am DrChe, and I think this would be my first YouTube OET related YouTube video. And as you know, many of you, I have helped a lot of nurses, doctors, pharmacists to pass their, especially their writing module and in speaking also. So here I am now today. I am trying to help you a little bit in writing part so that I'm going to start YouTube channel. So please, all of you should subscribe to my channel so that I make more videos. Many of you were asking for a YouTube channel, and finally I'm going to start. So if you subscribe, if you give any positive comments, so if you share my channel with other people, share my videos, so it will encourage me to make more videos. In today's lesson, this is for both doctors and nurses, for both, and in my with me I have nurses and doctors who are joining me today, and we will be discussing types of letters. Then we will discuss classification of letters. Then you will see how to write purpose for each type of letter. Then you will learn how to organize paragraphs for each type of letter, and then about conclusion, about the common mistakes. So many things you will learn in this video. So first of all, types of letters. So types of letters, there are four types of letter. So let me take Dr. Khalil. Dr. Khalil, can you please tell me what are the types of letters?
Yes. Referral letters,
Mm-hmm,
discharge letters,
mm-hmm,
advice letter.
mm-hmm.
Um,
What you can see on my
all,
screen, what you can see on my screen, the same one.
yes, normal referral, urgent
Mm,
referral,
mm-hmm,
discharge letters,
mm-hmm.
transfer letters.
So four types. There are mostly, usually we have four types. Normal referral, for example, Dr. Khalil, if you have a patient with pneumonia that is not very severe and that is not a child, so a moderate pneumonia, and you are writing this letter to a physician in a big
Yes.
hospital, in a tertiary hospital. So this would not be an urgent letter. This would be a normal referral letter. Second one is urgent referral. Can you give me any example of urgent letter?
Yes. Like stroke patient,
Stroke
acute
patient,
stroke,
yes, myocardial
like
infarction,
myocardial infarction, cancer
yes,
patient also.
yes, cancer patients, and angina, unstable angina. So
Yes.
all of these. So any other emergency. Okay. So discharge letter is, for example, patient came to you, you are in the hospital, you have admitted this patient in your ward, in your hospital. Now patient is going back to his or her home. This is the most common letter for nurses, the most common, because most of the cases in nurses, the patient is going back to home and you are writing this letter to the nurse in community. So in doctors, there are also discharge letters. When you have admitted the patient, you have treated the patient, now patient is going to home. So this is called a discharge letter. I also included here one type of letter, that is patient is still in the hospital. Patient is still in the hospital and you are writing this letter to update to the GP of this patient. So this is like discharge letter, mostly like discharge letter, but still it is not typical discharge, but is like discharge letter. Okay. And number four is transfer letter, mostly one from one ward to another ward, from one GP to other GP, from one community nurse to other community nurse. Okay, this is transfer letter. Uh, Let me take somebody, Miss Roshni. can you please tell me uh, when you are writing from one community nurse to another community nurse and patient is moving for a long time, what do you think is different? This letter is different from other types of letter.
The transfer letter, sir.
Yes, transfer letter. Yes.
Um, if the patient is um, with one facility for a long time,
Yes.
then that patient is going somewhere else for the
Uh-huh.
different treatment
Uh-huh.
in
So
another
here,
facility.
yes, here the problem is here one
Mhm.
GP or community nurse who is taking care of this patient for a long time, maybe 5 years, 10 years, 15 years. Now
Okay.
this patient is moving to other place where
Okay.
new GP and new community nurse will be taking care of this patient. This is not
Okay.
like just like referring patient for treatment of pneumonia. Here
Mhm.
you need to give all important medical history of this patient, all important risk factors, all important social history things, all current issues, any previous medical history. So all of these things. This is so in the purpose we need to mention patient is moving from here and they're like this. So Dr. Roshni, you can just resume what are the types of letters, please.
Yeah, it's but for the nurses, it's transfer letter,
Mhm.
discharge letters, referral letters.
How you
So
divide
if
referral letters? Normal and urgent.
referral,
Normal, urgent. For nurses, is the same. Okay, these four times are the same. Okay.
yeah,
So now let me take this is classification. This is my own classification. Okay. Let us say classification of OET letters. So this is classification according to the reader. Okay. According to the reader. Let me take Dr. Tatiana. Can you hear me?
Yes, doctor.
Okay. This is classification of OET letters according to the reader. Okay.
Yeah.
So this is my own classification just to, keep in mind that you are writing
Mhm.
to. So first, can you read my screen? What are the three main types?
Yeah. So first one is medical professional.
Mm-hmm,
We write to doctor or nurse.
mm-hmm,
Another second one is semi-medical.
mm-hmm.
So we are writing to
Occupational
physio,
therapist.
occupational therapist, physio, pharmacist.
Yes. Physiotherapist,
And then,
pharmacist. Okay.
yeah. And then non-medical to
Mm-hmm.
common people, simple, like to
Manage
manager
of
of
shelter home
shelter.
and
Yeah.
any patient of domestic abuse or any other person. For example, in nursing letters you are writing to parents of patients, parents of kids. In
Mm-hmm.
pharmacist letters, when you, for example, you are writing directly to a patient to advise about medication, about their side effects, their use. In nursing, when you are writing to parents, like a parent of a school of a baby who is studying in school, so in that case you need uh, normal language. Okay, so that is non-medical. For example,
Mm-hmm.
in doctors, if you are writing to a shelter home manager or any other shelter home or any other person who is normal, mostly it comes in nursing and pharmacist. And doctors, for doctors it is rare, but it can come here. You need to write to a medical non-medical professional. So medical professional that I use is typical for doctors and nurses. If you are writing a letter to a doctor or to a nurse, then I say it is typical medical professional letter. So you can use why we need this classification, uh, Ms. Tatiana, why we need this classification? Can you hear me?
Yes, because we should first of all, for example, if we write for medical professional, we
Mhm.
can include, medical abbreviation or
Okay, medical terms we can use. Okay.
yeah,
So
medical
here
terms.
with medical professionals, we can use medical terms. For
Yeah,
example, abbreviations, treatment, antibiotics, name of medication, all of these things. With
yeah,
semi-medical, occupational therapist, physiotherapist, pharmacists, we can use medical terms, but we should try to be use less
simple.
medical terms, less,
Mhm.
we should keep a balance between non-medical professional and medical professional. Okay, you can use medical terms, but we should try to keep it a little bit simple, as less medical terms as possible. Here with non-medical professionals, we should not use medical terms. Okay, for example, today in today's class with doctors and nurses, both of them, I was marking one letter, that was you were writing to manager of shelter home. So my question is, manager of shelter home is a doctor, nurse, or a common man?
Common man.
Common man. And there were, some doctors were writing, so I have treated this patient with flucloxacillin, antibiotic, morphine, surgical debridement of her. She was a patient of domestic abuse and she had burns. Surgical debridement, antibiotic, flucloxacillin, morphine, and all of these things, uh, and fluid resuscitation. Was it appropriate or not to write to a medical professional, to non-medical professional, writing about these things, antibiotics and fluid resuscitation, surgical debridement, using all of these terms?
No
No, I
sense.
think no.
No, I obviously no. And these students got C plus with me today because they were new students, but uh, we should avoid using medical terms. So uh, this was their first letter. Though my old students who were already taking classes, they have written very good letters, B grade letters. But new student who was taking first letter correction today got C plus, and they were writing medical terms and all of these things. So we should avoid using medical terms when you are writing to a non-medical professional. So let me take somebody else. Uh, RJ, RJ, can you please talk with me? Yes, please.
Rajneesh?
Yes, Rajanish. So this now we are talking about referral letter. Okay, referral letter. How to write
Okay.
uh, how to organize information in referral letters. So we have two options. Number one is chronological order and number two is order of importance. Can you please tell me what is difference between chronological order and order of importance?
Chronological order means the based on the date, I think.
Yes, based on dates. And what
Dates and
can
the
you use?
order of
No, use a simple words, simple words. Chronological order based on dates, but how dates? First, we
means
need to write the first visit, then next
yeah,
visit, the
first
next
visit,
visit,
second visit, third visit, like that it will come.
then the last visit, today's visit. This is chronological order. But we should start the first relevant visit. First
Okay.
relevant visit. Today or yesterday, I was marking one letter when there was, the patient was of pancreatic malignancy. And there was one visit 6 months ago about respiratory infection. And this student started first paragraph with respiratory infection that was 6 months ago. This respiratory infection is nothing to do with pancreatic malignancy. So this was irrelevant paragraph. So we should start with first relevant paragraph. This chronological order means first visit, first relevant visit, next visit, next visit, and today's visit. This is called chronological order. And what you think about order of importance?
First, we give the letter is an urgent, so it will be the present condition will be written in the first paragraph.
Yes, means order of importance means after purpose we need to write the most important visit. After purpose we need to write the most important visit. Mostly this most important visit is today's visit, but sometimes it can be second last visit also. Okay, so what I wanted to tell you, all of you, in referral letters, in normal referral letters, we can use both chronological order and order of importance, but mostly in normal referral we use chronological order because patient is not urgent. There is nothing urgent, we can use chronological order, but we can also use order of importance if it is necessary according to the situation. But urgent letters, we mostly use order of importance. Sometimes in urgent letters we can use chronological orders also, but mostly we use order of importance. So let me take Dr. Tatiana. Why we need to write order of importance in urgent letter, please?
Because it's urgent, so the reader should first of all to know what's happening, and then
Previous
can,
history and any past
yeah.
visit. So imagine you are a doctor, and I am sending you a patient. Patient is having myocardial infarction. Okay. Okay. I'm writing purpose. Hello, doctor. I'm writing this letter to you. This is Mr. Smith, and he has myocardial infarction, acute myocardial infarction of and your further urgent assessment would be appreciated. In the next paragraph, I am writing, Mr. Smith eats 2 bread per day, and he is a social drinker, and his mother died of lung cancer, and he eats junk food, and this and that. Then I write next paragraph. Mr. Smith presented 1 month ago with mm, mm, with cough, runny nose, and sore throat. I suspected respiratory infection, and I prescribed Augmentin. Then next paragraph. Today, Mr. Smith presented with a severe crushing chest pain that was not relieved with uh, nitroglycerin, this and this. Now you can see after purpose, I am writing about, junk food and this and this and this. What you will see? You will say, are you a doctor? After purpose, you need to mention me the most important thing. Why OET has changed. This was not a criteria before uh, August 2019. Since August 2019, OET has changed criteria. They say after purpose, we need to write the most important thing, most important visit. And our purpose should be concise. The reason is because medical professionals are too busy. If we write things from here and there that is not relevant, so they will not read letter because they have not time, they don't have time. So these are just tips. We need to be flexible. Sometimes order of importance is okay for some case, and for some case order of chronological order is okay. Social history and past medical history. Anybody can tell me where we should write social history and past medical history?
Yes.
Second paragraph.
Second paragraph. Okay.
Maybe first paragraph after purpose also.
After purpose, second paragraph. Yes.
No, first paragraph.
First paragraph before purpose.
No, after purpose.
After purpose, okay, first paragraph after means second paragraph after purpose first, okay. Any other opinion?
If the social history and the past medical history are relevant to their recent medical condition,
Uh-huh. Uh-huh.
if they are related with the patient's recent medical condition.
Talk a bit loud, please. People will be, hearing us later because.
Yeah. If the patient's social history and past medical history is relevant to present medical condition of the patient,
Uh-huh. Then what we should do?
so we can mention this after the purpose.
After purpose. Uh-huh. Okay, let us take Ms. Tatiana. Can you tell me where I prefer to write social history and past medical history, because you are one of my students?
Yes. You always advise us keep it before conclusion.
Why? What is the reason?
Save like that. You can save time first of all,
Uh-huh.
and
You don't need to think
can
where I'm
focus.
going to write, where I need to write this.
Yes.
You are always, you know that you are going to write it before conclusion if it is relevant. In my model answer, I usually use the same method. Another thing is, it is okay to write after purpose social history. Okay.
Mm.
In normal referral letter. But usually in urgent referral letter, after purpose, we need to write the most important visit. If you make a habit of writing a social history after purpose, then maybe in the real exam you get an urgent letter, then you write social history at the start, and then you will lose marks because you have not written the most important visit after purpose.
Important things. Yeah.
This is based on my experience, because some student told me after exam, "Oh, Dr. Che, this was an urgent letter, but I forgot to mention the most important visit after purpose. I have written social history." So that is why, based on my experience, I always advise my students to write social history and past medical history if it is relevant before conclusion. But please remember, it is not a rule. If the letter is not urgent, you can write after purpose also. Okay. To be safe, we should. I
Okay.
usually prefer my student to keep it at the end. This urgent referral, in urgent referral, we need to write first purpose. After purpose, what we should write?
The most important visit.
The
Today's
most
visit.
important visit. Yet usually today's visit, it can be second last visit. Then we are going to write past visits. Then, any other visit, then conclusion, social history, past medical history. And then order of writing medical visit. Order of writing medical visit. For patient comes, what they will do in your case notes in OET examiners, what they will do is they will write some symptoms. They will mix all things to test your knowledge. Okay, they will mix symptoms with examination. Some then randomly they will write investigations, and sometime they will write treatment. Little bit mix, not clear mix, but little bit mix. But why they are doing this thing? To check,
Confuse us.
to test whether the student can organize information, whether the OET students can organize information. So can you see my screen? What is written here? Order of writing medical visit. Can you see my screen? Yes.
Yes. Yes.
Okay. What is written on my screen?
Order of writing medical visit.
Okay. So even if the writer of the case notes mix these things, but when you are writing a paragraph, we should first write symptoms, then examination, then investigations, then treatment. This is logical order. There may be flexibility, little bit flexibility. Sometimes, we can mix a little bit according to the situation, but usually we should write like this. Mostly doctors know about this, how to write medical history, how to write this paragraph, symptoms, then examination, then investigation, then treatment. But this is a main issue for nurses. When they see a medical visit, patient comes with this symptom and then you found this on examination, on auscultation, you found crackles, and then on investigate chest x-ray showed infiltrates, and then treatment you prescribed augmentin. So this is a logical way. We should write first symptoms, then examinations, then investigations, then treatment, then review, whatever it is. But be flexible. There is no 100% fixed rule in OET. We need to be flexible. Okay. Now, third type of letter, that is discharge letter. Ms. Tatiana, do you remember something from our classes, previous classes, how we used to write discharge letters?
Yes, purpose of the letter,
Uh-huh.
then background about.
Then we, after the an admission is, in discharge letter, patient was admitted in the hospital. So when patient comes to the hospital, patient comes with some symptoms. Then
Yeah.
we do examination, then we do some investigation, then we treat this patient, we give some treatment. So first
Yeah.
we should write purpose, then we should write how patient came on the initially, patient came on this
Admission.
date. Yes, on admission, how was the patient's situation on admission? Patient came with these symptoms and his examination was like this and his investigation showed this and this, whatever according to the situation. That is not 100% rule. So we gave a background information about disease, what was done, how patient was treated. The next is we need to show progress, how patient has progressed during hospitalization. You can during hospitalization, patient has improved, deteriorated. We have changed this medication. We have changed this. We have referred to this doctor and this ward and this department, whatever it was done during hospitalization. So the most important thing is discharge plan. Okay. After progress, then we can write how patient is today. Today patient has progressed well and he can ambulate, he can walk, he can talk, he can do this, he can do this. Okay. His antibiotic course has completed like this and this. And after that we should write discharge plan. Discharge plan in discharge letter is the most important part. Don't miss any relevant information from your discharge plan. Okay.
Yeah.
Now my question is, let me take somebody else. Dr. Khalil.
Yes.
For example, you are pulmonologist, a respiratory specialist, pulmonologist, physician. I am GP. I am DrChe. I am teaching OET these days. I don't know too much about medicine. I go to my hospital early in the morning for 6 hours. Then when I come back, I am teaching OET this and this. I don't know what is the doses of, you know, rare medication, this and this. Okay. You have treated one patient that has TB. Okay.
Okay.
Anti-TB medication are used for how long? Minimum 6 months. Minimum 6 months. Some patients get for 8 months, 9 months. Some resistant patient who are resistant, then they get for 1 year also, 10 months, 1 year. So minimum is 6 months. You have, treated this patient for 15 days, 20 days. After patient is stable, his sputum is negative, you are sending this patient back to GP, DrChe, who does not know about doses and about how much you should give. And in discharge plan, you are telling me, okay, Mr. Che, okay, DrChe, GP, you need to give this patient isoniazid for another 2 months, rifampicin for another 2 months, and then ethambutol for no, these one you should stop isoniazid and no, this we should continue this for 6 months, yes, and ethambutol and pyrazinamide are stopped after 2 months or 2 or 3 months, like this, whatever. Okay, so some medication you need to stop after 2 or 3 months, and some medication you need to stop after 6 months. Okay, you are
Okay.
telling me this, but you are not telling me what is the dose of this patient for these medication. How can I continue this treatment of these patients, this patient? I cannot continue without, I don't have case notes with me. I only have your letter with me. Should you mention dose, frequency, and route of these medication? Yes or not?
Yes, I have to support you with any relevant
Any
data
details,
of
any
this.
relevant data? Okay. No, other scenario. Patient is having pneumonia. You have treated with antibiotic, you have given augmentin, you have given ceftriaxone, whatever the medication. Antibiotic course has completed 7 days, 14 days in your hospital. Now you are discharging this patient without antibiotic. You don't need to give antibiotic. You are only writing that his antibiotic course has completed. Now, if patient has pain or temperature, you can give paracetamol. Here you
Okay.
need to give me details of means doses, frequency of medication or not.
No, in this scenario, no.
This is no need. If you mention, it is not wrong, but if you don't mention, that is okay, because the course has been completed in your hospital. Now I am only going to give this patient paracetamol. Okay.
Okay.
Okay, so this is how discharge plan is important to mention. And any other care that you are going to do for this patient, or any care for relatives, anything important we need to mention in discharge plan. And this is very important. It should not be in yellow. This is important thing. Now my question that I have already asked most of you, Dr. Khalil, if you have a patient of
Yes.
pancreatic malignancy, the patient came 1 month ago, he was having pale stools and diarrhea and flatulence and this and this and jaundice. Then today you have seen the test and you see that liver function test is deranged and pancreatic enzymes are raised, and you think that patient has, you have ordered some other tests like CT, whatever. You suspect that patient is having pancreatic malignancy. No, the examiner will not give these two visits. That patient came with abdominal pain and pale stools, this and this, and then you order test, and then patient you diagnose malignancy.
Okay.
The examiner will give 1 or 2 irrelevant visits at the start. For example, 6 months ago, Mr. Smith came with a runny nose and his throat was red, his nose was runny, and he was having mild fever. You diagnosed common cold, or you diagnosed upper respiratory infection. You gave this patient augmentin. If patient was having not having shortness of breath and this and this. So now my question is this visit relevant or irrelevant for patient of pancreatic malignancy?
This is irrelevant.
Irrelevant. Excellent, great. But what now you can see, but in the real exam, those students who take OET without preparation, or they think they are very intelligent and they are very good doctors and nurses, they give, they first they let us try one time. If I can pass or not, then second time I will prepare and I will go do this and this. This is the main mistake of doctors and nurses. OET exam is not difficult. It's not difficult. Very easy with proper preparation. Okay.
Mhm.
So from GP to GP letter, this is very important. This is not common letter, Dr. Khalil. This is not common in OET,
Yes.
but sometimes, one time in 1 year or 2 times in 1 year, or sometimes 1 time in 2 years, GP to GP letters comes in OET. But when it comes, many students find it very, very difficult to organize how to write, what to do, what to not do, all of these things. That is why we need to prepare for this type of letter also. Here the main thing is current problem of this patient, but we should also summarize all previous relevant information about this patient, because the new GP is going to take care of this patient for a long time. He should know about risk factor. For example, if I am Che, I am going to another place, another city, to live at a new place. If my relative, my mother, my dad, any of them has diabetes or hypertension, and Dr. Khalil is my GP, old GP, and I'm now going to new GP. Dr. Khalil, is it important for you to mention my father and mother has hypertension, diabetes as a risk factor for new GP? Even I don't have hypertension or diabetes at this moment.
Yes, this is relative social history.
Relative social history, past medical history, family history, okay? But now consider, I am Mr. Che, the same patient. You are sending me to a nearest hospital. I am having severe pneumonia, and you know, are you going to mention his father has diabetes and his mother has hypertension? No
No, no,
need,
no
no
need.
need, no need. Okay, you can ask he has no past medical history. For me, if I'm not hypertensive, not diabetic, then no important to mention about my father and mother. You can see, Dr. Khalil, how our letter changes depending upon the situation and depending upon the reader. Okay,
Yes,
the
yes.
same patient is having risk factor. No, my other thing is another very important. This is taken from my letters. Patient, let me try it here. Patient is being discharged after treatment of TB. Okay, okay, Dr. Khalil.
Okay, with you.
So patient is being discharged after treatment of TB. Now you are writing a discharge letter. Okay, doctor.
Yes.
No, patient is living in UK. No, in UK. But for the last 3 months, patient visited to a country. Let us not take name of any country because people will feel. Visited a country who is endemic with TB. Okay,
Okay.
where TB is endemic. Okay, is this a risk factor or not? Is this a risk factor or not for TB?
Yes, yes, yes.
This
This
risk
is fact.
factor. Risk factor. No,
Yes.
no. If you are writing, what happened here? Okay, if you are writing about Mr. Che, and discharge letter. Patient came to you with shortness of breath, cough, this and this, and now you are writing a discharge letter. Patient was, you done sputum that was positive, culture was positive for TB, the CT scan was positive, X-ray was positive, and then you have treated with anti-TB drugs, and now culture is negative. Culture no, sputum is negative. Notes you are sending back to this patient to GP. Let us say GP is Dr. Tatiana, okay, and you are respiratory specialist. You are Dr. Khalil. Now, in discharge letter, my question, will you write that this patient went to this country for 1 year or for 6 months he visited, let us say, Latin America. Let us see where TB is endemic. He visited Latin America 1 year, 6 months ago, and he came back last month. Will you mention it or not for the GP?
For the GP,
In your discharge letter. This is a risk factor.
no, in discharge letter, no. I see.
In discharge letter, no.
Yes.
Excellent, Dr. Khalil, excellent. No, the same patient comes to you, you are GP.
Yes, comes from the GP.
Yeah,
Yes,
you
comes
are
from-
no GP. You are no
Yes.
de-escalated. No, you are GP, not a specialist. So,
Yes.
so now you are GP. You are sending this patient to a specialist, respiratory specialist. Still, you don't know what is the diagnosis. You are suspecting it might be TB. Patient having cough with sputum, with hemoptysis. So all of these symptoms, and patient went to Latin America and came last month, and now you are writing this referral letter. My question is, in referral letter, is it important to mention about this risk factor or not? In referral letter.
Yes.
And yes, it's better to
Yeah,
mention this.
it is better. No, it is very, very important to mention, because this is the risk factor we need to think about TB. If patient is going
Yes.
to a country where dengue is endemic, if you mentioned that patient came from that country and now patient is having fever, then you can suspect about dengue. Okay.
Yes.
In referral letter is very important. In discharge letter, it's not important. This is how our letters change when it is discharge letter or referral letter according to the situation.
Yes.
Know how to write purpose. Okay.
Okay.
My question is, doctor, in purpose, we have 3 marks in OET criteria.
Mm-hmm.
1, 2, and 3. Okay. My question is, if you get 1 out of 3 in purpose, 1 out of 3 in purpose, and your rest of the letter is 100% correct, 100%, no grammatical mistake, no clinical mistake, no organization mistake, nothing mistake. Okay. My question is, would you get B grade according to OET criteria? Yes or not?
Yes.
No.
Dr. Khalil says yes. Let us say what Miss Tatiana says. Yes or not?
No.
No. What about Miss Roshni? What do you say about this?
I think the purpose is the main thing. So
what? You will get B grade or not? Just tell me this.
I don't think so. No.
If your rest of the letter is 100% correct. Okay.
No, because purpose is the main thing. So if your purpose is not
Okay. Okay.
okay.
Mr. Rajanesh John. What do you think about this?
I think purpose is the main thing.
Purpose is the main thing. Excellent. If you get 1 out of 3 in purpose, you will not get B grade in your OET letter. Okay, even if it is not very good purpose, even C plus would become a bit difficult. Okay, so purpose is very, very, very important in OET, but purpose should be very concise, very concise. What we usually read in OET purpose, Ms. Tatiana, as you already know about these things?
The name of the patient, what's happened with the patient.
No, just forget about name. Everybody knows about this. What are the 2 main things that we need to write in purpose?
The diagnosis and the main problem.
Diagnosis, that is the main problem. And number 2?
What we want from the reader.
What we
Ongoing
want.
care.
Yeah, ongoing care, continued
Further
care,
assessment.
follow-up, further assessment and
Yeah.
management, endoscopy, MRI, all of these things. Okay. any of these things, not all of these things. So what is the main issue of this patient? Maybe patient is having pneumonia, TB, patient is having is victim of domestic abuse, patient is having, any operation, okay, hysterectomy, vonectomy, whatever, appendectomy or acute appendicitis, any kind of, sometimes in nursing or pharmacist, it is not a diagnosis, it is other kind of issue. Patient having adverse effects of medication in pharmacist letters, in nursing letter. For example, you are writing just to for a community, education, or for example, if there is some community problem, you are writing about this. So any kind of issue. So if you are writing what is the main issue of this patient in this letter and what we want from the reader, if you only write these two things, your purpose is okay, you will easily get 2 or 3 marks. If you write what is wrong with patient and what we want from the reader. In urgent letter, when we write a purpose, we usually use word urgently or urgent to show OET uh, uh, urgency of the letter. Since August 2019, OET has changed their writing assessment criteria. Any of you knows anything significant in writing criteria that they have changed?
I think that they are a request paragraph.
Yeah, in new criteria, the most important is the purpose. They have added a new thing. Purpose should be concise, to the point, and purpose is very, very important. Another thing is we should use after purpose the most important visit, most important information. Then other things that a language and conciseness and paragraphing, organization, all of these things. Okay, so there is change in. So what I want to say here is many problem is many free means free and in in commas, because these are written by somebody, then people share on social media, and these many free OET writing samples are many, you can see free or old OET writing samples are not good, are not up to date, right? Up to date with new writing criteria. Okay, doctor. The problem is many students just read these samples, and then they start writing letters according to uh, these letters, these samples. I know the common files, I can take their names, but it is not good, because then the authors will tell me that what you are doing, you are telling people against our stuff. So many OET letters are samples are on old OET writing assessment criteria, when there was no competition in OET, because OET was not recognized in UK. Since OET was recognized in UK, then there was a lot of competition in OET, and they have made things, made changes to make it, according to international rules and according to international uh, criteria and standard. So, and also, I cannot say, when there is competition, many students will pass and many will fail also, all of these things, I cannot talk on social media like this, but there is, increased competition in OET nowadays. Problem is due to increasing demand. No OET OET is, accepted in Australia, New Zealand, UK, USA, Canada, so Ireland, and in Gulf countries like Dubai and these, Arabic countries, and many other countries. Okay, Singapore, I think also, and other countries. Any other important country you remember? Anybody? So means all of important countries, all of most of the developed countries now they are accepting OET for nurses, for doctors, most of them. Some with limited, like Canada, USA, with for USMLE, all of these things. So what I want to say is there is increased competition in OET since for the last 2 years. That is why we need to prepare well. People, just one important thing. My student was a nurse. She took exam 3 months ago, 3 months or 4 months ago. In listening, she got like 360 or 70, maybe it means clear B grade, like 360, 70, and reading she got like 360, 70, whatever it was. So means B grade. She passed speaking also, and she failed writing. Okay, Miss Tatiana, what this student will do after this result? What she will do? She will go for any OET tutor who is teaching writing. She will improve her writing. She is thinking that she is very good in listening and reading. She got B, and speaking very good. She got B. She only need to improve writing, a little bit speaking. Maybe she got speaking in 330 or 20 or 40. So she came to me, and she joined my course, and she got in first time 260, 70, like this C in writing. So after a lot of discussion and this and that, and in new attempt she was able to get 300 in writing. That was her required score for UK C plus. Okay, you know what happened with her? This time she failed both writing and listening and reading. She failed both of them. And this happened to many doctors also, who was taking OET for the first time. They passed speaking, they passed writing, but they failed listening or reading. So what I want to say is, we should, even if you pass one time one module, you should focus it on all modules equally for the next attempt. Okay.
Okay.
So reason for writing a concise and paragraph or concise purpose or concise letter is, a background reason is that medical professionals are too busy. Even I know some students who pay me for writing, for speaking, and they don't have time to join the class. And even then I say, if you are not able to join the class, please get your refund. Some money that is left, for example, 1 or 2 letters money left. They say, no, doctor, no, I was busy, I could not join, no need to refund. But even if they fail exam, but they cannot send their letters or their speaking, who is already paid. What I want to say is, medical professionals are too busy. That is why we need to write concise letter, not very big letter. If you write very big letter, large letter, OET will not pass you, because OET wants us to write concise letters. Okay, Dr. Khalil now will talk with me.
Okay.
Dr. Khalil, this is how we typically write purpose. Okay. I am writing or thank you for seeing. Okay. Thank you for seeing
Okay.
Mr. Smith. I'm writing to refer Mr. Smith who has pneumonia. Okay, this is one style. Let us give it this color. Other for same who has sign and symptoms of pneumonia. Okay. Who has features consistent with pneumonia.
Okay.
Let us give this color. Who has signs and symptoms consistent with pneumonia.
Okay.
Let us this color. So there are 4 different ways to write the same thing. Here pneumonia is confirmed diagnosis. Who has pneumonia? Who has signs and symptoms of pneumonia? Who has features consistent with pneumonia? Who has signs and symptoms consistent with pneumonia? Here diagnosis is confirmed or possible diagnosis, Dr. Khalil?
Again, what did you say?
Here diagnosis is confirmed or diagnosis is possible diagnosis
Yeah, the first one is confirmed.
is confirmed. Okay, diagnosis is confirmed or based on my opinion, it is confirmed diagnosis. It can change later
yes.
with diagnosis. This is how we will write. So people, you can note it down after, you know, when you are watching this video on YouTube, you can note down these things. So here we have 2 styles. I am writing to refer Mr. Smith. What is other style, doctor?
Thank you for seeing Mr. Smith.
Yeah, excellent. Thank you for seeing Mr. Smith. Okay. Then we have 4 options. 1, 2, 3, 4. When diagnosis is confirmed. Or
Okay.
sometimes we can also add who, if it is discharge letter, who has been treated for pneumonia, who was
Yes.
admitted for pneumonia. Okay. If it is discharge letter.
Oh,
If
okay.
if there is question mark with pneumonia, what does this mean, Dr. Khalid?
It's means not confirmed diagnosis.
Not confirmed diagnosis. Can we use consistent word with this? Whose features are
Yes.
consistent? No, consistent, no. Consistent means confirmed. Then we read
Okay.
suggestive, whose features are suggestive of. Okay.
Suggestive. Oh, okay. Okay.
Yes.
Okay.
We can add possible, who has possible pneumonia, whose features are suggestive of pneumonia, who has signs and symptoms suggestive of pneumonia. Okay, something like that. Okay.
Okay.
And the other side is thank you for seeing Mr. Smith who has this. I'm writing regarding Mr. Smith when you are not sure it is referral letter, discharge letter, transfer letter. So we can only write word regarding. I am writing regarding Mr. Smith who was admitted for pneumonia, who has been treated for pneumonia in case of discharge letter, who has been treated for pneumonia. If it is discharge letter, Dr. Khalil,
Yes. It's update letter.
yeah, update letter. For example, you are a cardiologist, more the famous cardiologist of your country. Okay. And I am a small GP in a village. Okay. No,
Okay.
you are writing, I have sent you a patient because I don't know about, cardiovascular disease and you are the famous specialist. You have treated this patient. No, you are sending me this patient back to GP. Okay, back to me. You
Yes.
write, hello, Mr. Smith. Hello, small GP doctor. I am writing to update you on this patient. Okay. One is
Okay.
I'm writing to update you regarding Mr. Smith, or I am writing to update you on Mr. Smith. Okay. These are 2 styles.
Okay.
Okay. And if you are not sure you are writing to update you or not, what you are going to use?
Regarding.
Regarding. So it fits
Yes.
everywhere. Okay. It is what you say, universal donor. Okay.
Yes.
Universal donor. It can,
Yes.
everybody can take donation of blood. So other thing is the next, this is first part, what is wrong with the patient. Second part is what we want from the reader. If it is discharge letter, he is being discharged tomorrow and would require your further care and support, would require your follow-up, whatever it would require is a polite language. We should use polite language, okay?
Okay.
If mostly if it is a referral letter, your further assessment and management would be highly appreciated. If it is, discharge letter, mostly in nursing letters, your continued care would be highly appreciated. Your follow-up care, your follow-up, whatever, okay? What do we want? For example, your further management, including an MRI would be appreciated like this, biopsy, endoscopy, whatever you want from the reader.
Okay.
What about this? This is urgent letter or normal letter?
No, this urgent letter, urgent referral.
Yes, urgent referral. I'm writing to urgently refer, okay? Urgently refer. Mr. Smith, okay? Another place where we can write your urgent assessment and management would be highly appreciated. Let me write. I am writing to urgently refer Mr. Che, who has signs and symptoms of consistent with this is not acute MI. Okay, let us write abbreviation acute MI.
Okay.
Your further
Assessment.
and management would be highly appreciated. Okay,
Okay.
this is urgent letter or normal letter?
Oh, this is urgent.
Urgent letter. So how you know
Yes.
this urgent letter? For the
Because
diagnosis,
it's we mentioned it's with,
diagnosis. But even
MI.
diagnosis acute, diagnosis acute, we should mention urgent. Okay,
Okay.
we should mention urgent. Another place. So let us remove this one where you can write no, this urgent letter where you can write other place, not here.
Your urgent assessment and management would be highlighted.
Excellent. Your urgent assessment and management would be highly appreciated. Okay, this is if you want to get B grade. Okay, but
Okay.
there are some people who need A grade. Okay, if they need A grade, then they are going to write urgently here and urgent here. I have written to urgently refer Mr. Che, who has signs and symptoms consistent with acute MI. Your urgent assessment and management would be highly appreciated because they want A grade. Okay,
Okay.
I'm just criticizing. Okay, I'm just criticizing. We should not write
Yes, you are
urgent.
good to know this.
Because they need A grade. Because you know why I say grade. One student contacted me some days ago, a long time ago. Contacted me. Okay, hello, Dr. Che. Okay, I said yes, please. How can I help you? Okay, he said, I need A grade in all modules. Okay, I've asked. Okay, I usually reply to everybody. I said, why? I said, could you please tell me why you need A grade? Because I want to move to UK. I am a doctor, and I want to take plab. I told him, for plab, you don't need A grade in every module. You only need 350 B grade. Okay, in all modules. Then he said, okay, I need to pass this exam and this. So if you want A grade, then you can try to, otherwise you should write on one place, here or here. Okay.
Okay.
So sometimes we need to add something as further assessment and management, including an MRI, including bronchoscopy, endoscopy, whatever the procedure is, we should mention, we can mention. Then we write conclusion. We with MRI, we use an MRI. Okay, doctor. Why we use an
Okay.
MRI?
It's phonetic M.
Yeah, excellent. Due to sound M. Okay, sound is like M, like this. So this is sound of sound of A. That is why we need an MRI. Okay, do sound of MRI. Okay, an MRI. What about this RTA, road traffic accident?
Also an RTA.
An RTA. Okay.
Yes.
So let us take break for 40 minutes. This is just, when I was giving private lecture. No, we don't need break. We need to finish. Just a little bit is left. So I am writing regarding Mr. Smith. I am writing to update you on Mr. Smith. I am writing to update you regarding Mr. Smith. No transfer letter. Transfer letter. Ms. Tatiana will tell me what is different in transfer letter that we need to mention in purpose that is not written in other and other types of letters purpose. Are you there?
Yeah.
If you remember anything, let us help you. This thing. Patient is transfer letter. The patient was moving from one GP to other GP, from one community nurse to other clinic. So we need mention. I'm writing regarding Mr. Smith, who has pneumonia, who has diabetes and hypertension. He is moving to name of the city here. For example, he is moving to whatever the name, Manchester. Okay, because people of Manchester will become angry. Okay, we should not. He is moving to Manchester and would require your care, further care, follow-up care to live with his daughter. Okay, like
Ongoing
this.
care.
Yes, whatever. No, my favorite, some grammar questions. Okay. Mr. Smith has had diabetes since 2000. I think we should finish because it is too long class. Or we should complete this part. What do you think?
Let's quickly complete and that's it.
Quickly, okay.
Yeah.
Dr. Khalil, what do you think about this?
I think for this point or about the complete session.
No, just a little bit more. There is. We should continue for 10 more minutes, or we should finish.
Okay. Regarding this point, I think he had the M. I think simple past. We can use it.
I will explain it, but just I'm asking about we should continue or not.
Okay, we should continue 10 minutes. Okay.
Okay, we should continue. Okay. What about other people? We should continue or not?
Continue, please.
Okay, we should continue. Okay. So now this is common grammatical mistake. Mr. Smith has had diabetes mellitus since 2013. No, the next is, let us make it separate. These are three sentences. Mr. Smith has had diabetes since 2000. He has been diagnosed with diabetes in 2013 and he has diabetes now. Now my question is, first sentence is correct or not? You should write, all of you, in the chat. First one is wrong or correct? In the chat, please. If you are watching my YouTube video, you can write in the comments which one is correct, which one is wrong. uh, uh, to participate actively in a class, if you participate actively in class, means you comment, you participate actively, you will learn more than other people that who participate passively. So first one is wrong or correct? Okay, let us talk with Dr. Khalil. Dr. Khalil, what do you think about first sentence? Is it correct or wrong? What color I should give? Green, yellow, red? Do you have any idea, doctor? Okay, anybody else can participate? Anybody else want to tell?
Yes, yes. I think the correct tense is the third one, simple
No,
tense.
first one is correct or not? Just tell me this one, please.
No, no, it's not correct. This is
wrong. This is wrong.
This is
Okay.
present perfect. Yes,
No,
present perfect.
no need to tell why it is, but it is wrong. Okay, according to you. Second one,
Yes. Second one also wrong.
this is wrong. Okay. This
Yes.
one,
Yeah, this is okay. Correct.
this is okay. Correct. No, Mr. Smith was diagnosed with diabetes since 2013, and Mr. Smith was diagnosed with in 2013. Okay, this one,
Yeah, this is wrong.
this is wrong.
Yes.
This one
It's okay.
is
Green.
okay. Okay.
Yes.
No, my question is why this is correct?
Because we use since with present perfect.
Just this one. Why it
Not
is why it is correct? Only my this question is why it is correct.
because we put here a verb diagnosed.
No, the time period. This is something in the past. In 2013. In. When you use in 2013, then we need to use past tense here. Was diagnosed.
Okay. Yes. Yes.
We are not using for, we are not using since. For instance, is something time period. Okay, point of time period about these things. Okay, here
Okay.
we are only using what happened in 2013. No, this one, why it is wrong?
We don't use since in this past
Since,
tense, simple past tense.
no, yeah, since we cannot use because here we are writing about past tense. Here, if we are writing to was diagnosed, we should use in here. If we want to use since, we should use has been diagnosed here. Okay, so this is wrong.
Yes, has been.
This is simple past. We don't know how much time patient is having diabetes, but
Yes.
she has currently she has diabetes. We can write like this.
Yes, we
She
are
has,
dealing here like a fact.
yes. No, this one.
Has been diagnosed. This is means diagnosed in recently in recent past, but not in
So
2013.
we can write here since, then it is okay or not?
Still, it's not recent past. It's a long time.
He has been diagnosed with diabetes since 2013. Is it correct or wrong?
It's wrong.
No, it is
correct.
correct. Is correct. She has been diagnosed since means she was diagnosed in 2013, and since then she is having diabetes till now. Something, Dr. Khalil, is a very common mistake. Something started in the past and still continues. In that case, we can use present perfect. Okay. He
Okay.
has
Okay.
been diagnosed with diabetes since 2013.
Okay.
Okay, it is okay. And this one,
I had.
you said it is wrong. You said it is wrong. Why it is wrong?
We had diabetes. Actually, it's grammatical. It's okay, but I said wrong because I don't prefer.
No, it is okay.
I don't.
Has it is okay. Has it is okay. There's not a problem. It is okay. We can use like this. This is commonly we use in OET. Sometimes we use in OET. He has had diabetes since 2013 is okay. It is not a problem.
Okay.
Okay. The next thing is, this is also common mistake in some letters.
Dr. Shay, just I have one question
Yes, please.
in the last point.
Yes.
What's the preferred phrase of these phrases?
This, if you want to mention period of time, since dad, she is having still diabetes, this one is okay. She has been diagnosed with diabetes since 2020. This one is also good. She has had is also good. In OET, it is good. This one.
Okay.
She has had diabetes, it is good. And this one is also good. Okay, both are there. Sometimes we need to write about something that was diagnosed in only in that time. We don't need to mention about period of time. Then we use was diagnosed, simple past. Okay.
Okay.
For example, if patient was diagnosed with acute appendicitis in 2013, this is only one time. She is not still having acute appendicitis. Okay.
Yeah.
But
Yeah.
we say she was diagnosed with acute appendicitis in 2013. This is not chronic condition. This is a common mistake. People with chronic condition, we should use like this, but with acute conditions, we don't need to use like showing time period. We cannot say he has had acute appendicitis since 2013. It means she is having acute appendicitis for the last 10 years. That is wrong, okay?
Yeah. Clear.
Miss Tatiana,
Yes.
first one,
Wrong.
wrong. Red,
Mm-hmm.
this one,
Smoke. I think it's present. He smokes 10 cigarettes per day. For me, it's okay.
for you is okay. This one,
As well.
is wrong. Okay.
No,
No,
it's correct.
is correct.
Mm-hmm.
Okay. Dr. Khalil. Dr. Khalil, please. Okay, let us take somebody else because
Yeah. With you. I
okay.
think the first one it's okay.
First,
Correct.
okay. Let me copy again here.
Okay.
So you're saying first one is okay.
Yes, it's okay.
Second one
Second one, it's not okay.
is not okay. Red.
Yes,
Third
right.
one
Third one, it's okay.
is okay.
Yes.
So rest of the people, there are two more students. So do you agree with Miss Tatiana or do you agree with Dr. Khalil? Let us see.
Maybe they have another opinion.
Okay, let us ask them separate. It's okay, let us only ask about this sentence. Mr. Rajanesh, John, please. Mr. John,
Yes,
only John. Okay, what about this sentence? Is it wrong or correct?
that's wrong for me.
For you, it is wrong. And
Yeah.
this one?
Yes, correct.
This one is correct. And this one?
Yeah. That also correct.
Correct. Okay. So you are with Miss Tatiana. Okay. So let us take now Miss Roshni, please. This one? Is correct or wrong? Okay, let us now discuss. He has been smoking 10 cigarettes per day for the last 10 years. Dr. Khalil, you said it is correct. No, let us ask Ms. Tatiana, why it is wrong, please?
He has been
He
smoking.
has been is wrong. What is wrong here?
Something with the last 10 years.
Something with the last 10 years? What is wrong? Since last 10 years?
No. I don't know. Something is wrong.
What is wrong? This is a common mistake.
Is it for me? It's not sound correct.
It does not
I
sound
can't
correct.
tell you.
Your sixth sense says that it is wrong, but you don't know the rule. Okay. Dr. Khalil, why you say it is correct?
I think it's correct. It's he's smoking for last 10 years and still smoking. So
Okay.
he has
something. The rule is something that started in the past and still continues. Okay. Something started in the past and still continues. We should use present perfect. Okay. So he has been smoking 10 cigarettes per day for the last 10 years is okay, is correct. Okay.
Okay.
Correct. Why it is wrong here? No, let us no. Miss Tatiana. Miss Tatiana. Why it is green? Because it sounds correct or it is grammatically correct?
For the last 10 years. It's past.
It's past. You mean he smoked?
No. Yeah, if you want to put everything in the past, he smoked maybe in the past 10 cigarettes per day. Last 10 years ago.
Maybe some of you, maybe as many of you will be, reading this, watching this video. Let us remove last, okay?
Yes.
For 10 years, okay? Just no,
yes.
No, Miss Tatiana, no. No, let us move this.
Everything looks okay.
Everything looks because why? Because your sixth sense says that is okay, okay? No, Dr. Khalil.
I like it.
Why you like it? You like it, yeah. That is good. That is good. Dr. Khalil, why you say it is wrong?
Because this sentence contains the word last. I preferred without last.
No, that is not a problem. The problem is here we are using time period, okay? That is not a problem.
Time period is okay. Grammatically is okay. Time period is okay.
The problem is when we are using time period, then smokes is not good. Okay. He smokes, no, he has been smoking for the last 10 years.
Yes.
Okay, let us change it because some people can confuse with say last or this. Let us change since 2010. No, there is no doubt in this logo, this time, this place. So no, since 2010. He smokes 10 cigarettes per day since 2010. It is okay.
No,
No.
not okay.
No.
This is the issue. The issue is here. He has been smoking. Something started in the past and still continues. We should use present perfect. He has been smoking. Okay.
Yes.
And this last is a green hair and is green hair also. So at least at one sentence, you people have agreed. So clapping. Okay. So he smokes.
Yes.
This
Thank
is
you, doctor. Thank
yeah,
you.
yeah. This is like this. He has diabetes mellitus. This part.
It's the same.
Yes, he has diabetes mellitus, or he smokes 10 cigarettes per day. This is the for routine we use present simple. He smokes 10 cigarettes per day. He drinks 10 glass of alcohol per day, per week, like this. Okay. For routine we use this. This is about passive voice mistake. This is we should not mention because we are tired, I think. This is about child. When we are talking about some child, for example, in one letter, this is name of the child is Joshua Vance. And when you are writing in the in your letter, what we should Mr. Vance or
No.
Vance or no, Mr. Tina, you will not talk about this. Let me ask Dr. Khalid.
Joshua. Yes, we use
Joshua.
Joshua only.
First
Only,
name,
yes.
excellent. First, for children, we use first name, okay? Only Joshua for children.
Doc, you should to do another class for everything this.
But
You should to do another class. You should to have another. We should to have another class
yes,
for this information.
yes. So today's visit, we can use present simple tense, present simple or present simple or past simple, both of tense. But in today's visit, but most of the students what do is they mix. For example, he presented with cough, sputum, and hemoptysis. Though he presented, okay, past tense.
Okay.
Then they say, and he has low blood pressure. So you are started with the past, then continue with past.
Yes.
Okay.
Yes.
So where it is possible, for today's visit, we should stick to one tense, present simple or past simple. Mostly past tense looks better, okay? Past tense looks better mostly, okay?
Okay.
Mr. Smith presented with cough, fever, his examination was unremarkable. Then people say his examination is unremarkable. Okay, it's not. Here you are using past, here you are using present. That is not good. We should be consistent with one tense. Okay. Today, Mr. Zimmer presents with cough. His examination is unremarkable. Now, this is present simple style. Okay.
Okay.
Let us. I think we should finish. Okay. Rest of the things we will discuss.
Okay.
So let us give some message to the because this would be the first video of my channel. What should be the message? In my channel, you will not first of all waste your time. Okay, most of the videos will be informative. Okay, by watching my videos, you will not waste your time. What you can do is you can subscribe to my channel. I am not, because you can see Mr. Tiana and Dr. Khalil, all of you know that I have very good presence on my Facebook groups. I have, group. I will share my link to my Facebook group below in the comments, so people can join my Facebook group. That name is OET Preparation. This is my main group that I started. So if you subscribe to my channel, what is the advantage of Mr. Tiana to subscribe a channel? Oh, Mr. Tiana is there. Yes. What is the advantage to subscribe a channel?
A
I will
lot of
get
people.
I will get too much money. Okay.
No, a lot of people will learn.
No, number one is when new monetizing these things are you people know I don't tell lie in my Facebook groups and here also. When you have a lot of views, you can get monetized, you will get some money, little bit, not very, because in educational channels are not seen in millions, just in hundreds, you can say even official and very famous OET channels, so they are just thousands, hundreds, thousands views only. So if you subscribe, when I will upload new video in this channel, you will get a notification of new video. Okay, so you
Okay.
can easily watch new video when I will
Oh,
yes, so you will get notification of new video. This would be the first one. Then I will upload new one. You will get a notification. So if you
okay.
can subscribe, what else people say after their channel? Like, comment, and
Like or
share.
dislike?
Dislike, no. If people will dislike, I will not make more videos.
Talking doctor.
So like, comment, and share with other people. Okay.
Okay.
So thank
Ac-
you. You are the, what we say, founding fathers of my channel, Miss Tatiana, Dr. Khalil, and Miss Roshni. She has left, and Dr. or Mr. Rajanesh John. So all of you are my founding fathers of my OET channel. Okay. So
Okay.
I will always remember for all of you. Okay.
Thank
Okay.
you.
Thank you very
So
Okay,
much,
thank you
so all
very
doctor,
the
for your
much.
help.
I just wanted to, involve somebody, because if I am only talking, people will not understand. So if it is two-way conversation, so people can easily understand. So people, no,
Yeah.
one more thing, Miss Tatiana, many people,
Mm.
I have some students who don't have Facebook account and they find it a bit difficult. So I will also share my WhatsApp number at in the comments of this video. Okay, here below in the comments,
Right.
you can see my WhatsApp number also. So you can contact me. Maybe I am free. I can help you. Some nurses, doctors, pharmacists, all of you in writing correction, in speaking.
No, just
Maybe
doctors.
why?
Nurses don't need help.
No, I have new courses for nurses also.
Okay. You said that
Yes.
you want, you don't want
Yeah,
to
it was
go.
with first batch because it was very
I
difficult.
understand this.
You remember, doctor, one of your colleagues,
Mm-hmm.
Miss Asma
Yeah,
Star. She got, she passed writing part. She
but
was
failed.
very no, but
She passed. She
she
passed the
passed
exam.
writing.
Ah,
So any
it's
other
perfect.
thing, other people, but doctors are very good. They know clinical language. They pass
I
very
know.
easily.
Don't need to tell about the doctors. I know that your doctors, they are very good.
But
They are the
nurses
best.
also. Ah, do you
Okay.
remember? Do you remember nurse Lucas? Is your friend
Yeah.
also? Your friend?
Okay. Uh-huh.
Yes, remember.
He
Do you
passed.
know? Do you know how much he got in writing?
How much?
How much?
Grade A?
Do you remember? If you have talked with him,
No, I didn't.
he had taken OET for 3 or 4 times, 4 or 5 times.
Ah,
He
yes, about that.
never he never got above C in writing. This is true. I'm not telling a lie. You can talk with him. He can comment in the below in the chat. I can even show his chat if you wish, but it is, I need to keep some, personal things.
Mm.
He never got C. And one time he said, I am fed up. He just got 2 letter correction with me before his second last attempt. With 2 corrections at the end of your just 2 days before exam, you cannot improve anything. But if he joined with us, you remember he joined with us in the first
Yeah, yeah.
nursing course. And his required score was C+ in writing. And he never got in 4 or 5 times. He was fed up. He wanted to give up, and but you know how much he got this time in writing? B.
How much?
B.
B?
Yes,
With that
B.
letters? Oh my god.
Yeah, but
I
he
will take,
at the
I will
start.
get A.
Yeah. Do you want me to show his result? Yeah,
Yeah.
this is true. I don't tell a lie. You can talk with him. He was your colleague in the class. He got B in writing. That is true. And he is one of my this is one of my greatest success, because he was fed up. He wanted to give up, but he got B, from C to B. Okay, it's a very good
That's
success.
good.
Okay, yes, it is true. It is true. You can talk with him. Okay.
Yeah.
So
Okay.
thank you everybody. Thank you for so just say, Miss Tatiana, like, comment, and share my videos and channel. Okay, and subscribe
Of
also.
course. Of course,
Okay,
doctor.
okay. Thank you,
Okay.
doctor.
Okay, thank you
Bye.
everybody.
What
Bye.
will be the next session, Dr. Che?
For a channel, no,
Yes.
on Facebook I'm usually online, but for YouTube I don't know, because I need to make clean and to the point videos, maybe sometime, but on Facebook I am online.
Okay,
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 okay.
thank you. Dr. Khalil,
Thank
Bye.
you.
this is not Dr. Khalil, this is not just to uh, I have a lot of students with me, as you were helping me and participating with for my video and for this class. If you want any more help, I can give you any good discount. Okay,
Okay,
just to
okay.
to
Thank
be
you.
as we become friends here. Okay, Mr. Tian
Three
is
Thank you
letters
already,
very much.
free.
Mr.
Three
Tian,
letters for free.
yeah, you are already on, what we
I know
say.
that you don't want me in your classes. You already
No,
told me.
you have already taken, but you can send me more letters for free, for
I
voice notes.
sent you. I sent to you, and you didn't say. You
When,
saw the letter, but
when?
oh, 3 or 4 days ago
You need to remind.
on WhatsApp.
I get too busy. You need to remind. I will send you voice notes. Okay. I don't take any
Okay.
extra money.
All right. Okay, doc.
Okay. Thank you.
Take care. Bye.
Thank you. Thank you.
Thank you.
Thank you, doctor.